Have you ever heard of a disease that clogs up your body's most important filter with microscopic log-like structures? It sounds like something out of science fiction, right? Well, today, we're going to unpack a rare and really mysterious condition called Immunotactoid Glomerulopathy. I know, it's a mouthful, but stick with me. We're going to break down exactly what it is and why it's so important to understand.
So let's just start with this one big question. What actually happens when your body's most critical filter just stops working the way it should? Because really, that's the core of the story we're exploring today.
All right, so before we can really dig into what's going wrong, we have to understand what it looks like when everything is going right. So let's take a closer look at this amazing filtration system our body has, the kidney's glomeruli.
Think about making your morning coffee. You've got that filter that keeps the grounds out, but lets all the good stuff, the coffee, drip through. Well, your glomeruli are basically doing the exact same thing, just way more sophisticated. They're these tiny, tiny filtering units in your kidneys, and their job is to clean your blood. They let all the waste products out into your urine, but, and this is crucial, they keep all the essential proteins in your bloodstream where they belong.
So what happens if that coffee filter gets a hole in it? You get grounds in your cup, right? Well, it's pretty much the same idea with damaged glomeruli. When the filter breaks down, things start leaking out that shouldn't. You get protein in the urine, that's proteinuria, and that's what can cause things like swelling or edema in your legs and feet. Even blood cells can slip through. All of this just creates this cascade of problems, like high blood pressure and ultimately a drop in your overall kidney function. Okay, so what's actually damaging this filter? In the case we're talking about today, it's not just a simple tear or a hole. Nope, it's something way more specific and honestly, a lot more mysterious. It's a very particular kind of clog. And this is our culprit, Immunotactoid Glomerulopathy. It's an incredibly rare disease where the body's own immune system basically goes rogue. It starts creating these abnormal protein structures, these tiny little tubes called microtubes that literally start to build up and clog the kidney's filters. Now, that name, immunotactoid, it sounds super complicated, I get it, but it's actually really descriptive if you just break it down. Immuno tells you it has to do with the immune system, the body's defense force, and tactoid, that's just a fancy word for rod-like structures. So all it really means is a disease caused by rod-like structures that come from the immune system. See, not so scary when you pull it apart. Now, figuring out that this is the specific clog that's causing all the trouble, well, that's not exactly straightforward. The symptoms can look like a whole bunch of other kidney diseases, so doctors have to become real detectives to solve the case. And this really is the million-dollar question, isn't it? If a patient comes in with swelling and protein in their urine, how on earth can a doctor zero in on this one super rare condition instead of all the more common ones? Well, the answer is actually fascinating. You see, a standard light microscope, it just doesn't cut it. At that level of magnification, the kidney tissue can look like a dozen different diseases. But an electron microscope? Whoa, now we're talking magnification of over 10,000 times. It's only at that incredible zoomed-in level that the true culprit finally reveals itself. And this quote just nails what they find. Under that super powerful microscope, these protein deposits have a very distinct, highly organized pattern. They're not just random gunk. Pathologists describe them as looking like a stack of pipes or logs. This unique visual signature, this structure, that is the smoking gun. It's what confirms definitively that this is immunotactoid glomerulopathy. Okay, so we know what is clogging up the filter. The next logical question is, of course, why? Why is the immune system creating these bizarre structures in the first place? And the truth is, we don't know the exact cause yet, but we have some very, very strong clues. This disease almost never shows up by itself. It's often the sidekick to another bigger problem. It's frequently linked to other serious conditions, like the blood cancers and autoimmune disorders you see here. This is a massive clue for doctors because it tells them the kidney problem isn't actually the root cause. It's a symptom of a much larger battle going on somewhere else in the body. So, to figure out what to do, you have to trace the source of these proteins. It's pure detective work. Are the proteins coming from a single gang of rogue cells? That's what we call monoclonal, and often points to something like a blood cancer. Or are they coming from lots of different sources, what's called polyclonal? That usually suggests an autoimmune issue or an infection. Making this distinction is absolutely everything because it tells doctors what they really need to be treating. So, with a diagnosis finally in hand, we get to the questions every single patient is going to ask. What happens now? What can we actually do about it? And this is where things get really, really challenging. There's no magic bullet for this disease. There's no single approved treatment. The therapy isn't really for the kidneys themselves. It's focused on whatever that underlying condition is that's causing the problem. If it's cancer, you treat the cancer. But if you can't find the underlying cause, the options become very, very limited. The prognosis, frankly, is a sobering one. For a huge chunk of patients, somewhere between 40 and 50%, the disease will eventually progress to end-stage kidney failure. Let's actually look at what that timeline means for people. You know, by the time most people are even diagnosed, their kidneys have already taken a hit. Then, for that 40 to 50% we just talked about, over the next 2 to 6 years, things get worse until they reach what's called end-stage kidney disease. And at that point, their kidneys just can't filter their blood on their own anymore, and they need life-sustaining treatments like dialysis or even a kidney transplant. And so we're left with this question. We can see the damage, we can literally see the logs clogging the filter under a microscope, but we still don't fully understand why it's happening. Unlocking that why is the key to everything. It's the only way to find a real cure. It's just a powerful reminder that even with all of our modern medicine, there are still big mysteries left to solve. And for the patients living with this disease, solving this one just can't come soon enough.